Hey everyone, welcome back to my channel. My name is Cheyenne and I am a registered home health nurse. I have been working with this company for the past 8 weeks and it's been amazing. So I thought I would take you along with me to work today. I used to do private duty home health, and that's where you work with one person your entire shift. It's my work phone. You work with one person the entire shift and you just care for that one person. Now I'm working, plus I did peds with kids. Now I do more geriatrics and mainly adult, but a lot of it is geriatric patients. So the learning curve is wild. Like, I'm learning so much, and I just wanted to take you along with me today. So as of yesterday, I had a start of care, which is an admission, and 4 routine visits. So I'm up to full productivity now that I'm on week 8 of orientation. So yeah, but the start of care that I had, she isn't discharged yet. We thought she was out of the hospital, but she's not. So I'm not going to do her today. And then one of my routine visits doesn't want to be seen today. So now I'm down to 3 visits, which can happen, which is why I recommend, if you're gonna do PRN, like if you want to do home health, think about doing PRN and having multiple agencies to work under, because I'm running into a lot of the patients don't want to be seen that day. Somebody cancels last minute and then you're out of money. So I should also add, I'm a case manager. So I have to oversee the LPNs, the CNA, and just make sure that the case is going smoothly, everybody's doing what they need to do, and that the patient is progressing. So that's probably the scheduler texting me, probably trying to set up more visits, which is nice because the schedulers definitely have control over, not control, but they definitely play a part in your productivity for the day. So if somebody bails out on you, the scheduler will be like, hey, I have another person in this area kind of close to you, do you want to take it? And typically I say yes. But yeah, I just got done dropping my son off at school or daycare, and I'm going back home to get my work stuff because I didn't want to take my work tablet with me because it tracks your miles. So if I were to stop at my son's daycare, it would think that that's a visit, and then it would start tracking miles. So I leave my tablet at the house because actually one of my cases is right by my son's daycare. So it would have thought that I was stopping at his house. So I left everything at home. So I'm just going home, picking up my tablet and my bag, probably gonna grab like a snack or something. And then my first visit is at 8 o'clock, which I typically don't see people that early, but this guy requested to be seen early because he wants to get on with the rest of his day, which I completely understand. So I'm almost home, I'm on my street, and then I will check back in with you guys soon. Hey guys, so it is currently 10:04. I stopped and got something to eat because it's been a day. So I ended up seeing my first 2 patients. The first one, I got there and I guess I didn't read his chart fully. He ended up having 4 wounds that I knew nothing about. So I had to change said wounds, clean them, dressing change, all the things, and then document on them. So it set me behind. I'm supposed to be on my 3rd visit, and I'm on my way to my 3rd visit, which is fine. They're typically very understanding about, like, don't tell them that you're going to be there at 10 and then show up at 12. But I typically say, hey, I'm going to be in your area tomorrow. Is it okay if I see you tomorrow between 10 and 11? So that it gives me a little bit of wiggle room, because you never know. Like with my first visit, he has skin cancer and he keeps developing different moles and things, and then they get removed, and then he has a new wound that we have to dress and change and all that. And I am his case manager, but it's the first time that I met him today. He was so sweet. But I don't even have the GPS on for my next client. I've seen her before, but it's been like weeks. So I'm just hoping that I remember where her house is. And you have to park in like an alley to get to her house. It's a whole thing. But today's been going well. My start of care fell off because she has not been discharged from the hospital yet. So I don't have a start of care today unless scheduling finds one for me, which is fine. I mean, it's not the end of the world. But yeah, so let me get off of here. I'm gonna go in and see this third patient. She has a foot wound, diabetic ulcer. Gonna change that, and then it's just a regular routine visit. So I'm just going to get her vitals, listen to her heart, lungs, do some education on her foot and diabetes management, and yeah, that's about it. So I'll see you guys in a little bit. Who y'all? Okay, so just saw my 1, 2, 3 third patient. I have one more to see, plus a 99, which is, there's like buddy codes when it comes to nursing. I should have gone there, even though I just got Chick-fil-A. I wanted McDonald's so bad, but I was closer to Chick-fil-A. Now I'm closer to McDonald's. Anywho, I have a 99, which is an end of episode reminder. So it's letting me know that the person's episode is coming to an end, and it's my job to decide whether to recertify them or discharge them, which is hard because being new, I don't know a lot of these people. I see them maybe once for 30 minutes, and then I'm left to decide whether they should stay or they should go, which is hard, but it's part of the job and you have to do it. So I did see her on the 10th. So I'm gonna go back and look at my documentation, read my notes, see what she was doing then, and compare it to what's the last LPN saw, and I'll make the decision. And I think the hardest part of case management for me has been that, making decisions, because my other job, like the job I had before this, chill. I watched TV, I transferred, did all that type of stuff. It was more of like an aide job, to be honest, but they just happened to have trachs, so they couldn't have CNAs because of the trachs. So a lot of my job was very easy. I'm turning this turn signal off. I know that's probably driving y'all insane. A lot of it was just very simple stuff to do, and now that I have this job, your girl is out here learning and working, and I love it. I love home health. I've always loved home health, but now this side of home health I love a lot more. My patient today that I saw just a little bit ago, she was like, I keep getting blisters on my feet and I keep bumping my toes. And I was like, well, are you wearing shoes in your house? No, who wears shoes in their house? I said, being diabetic, you really should wear shoes in the house. And she's like, why? That's so weird. I said, yeah, well, if you were bumping your toes with shoes on, do you think you would get open areas on your feet? And she's already lost, I think, the wound I did today, I'm pretty sure she lost her pinky toe and her fourth toe. And they were all started from an open area on her foot that she just couldn't heal. So a lot of it is just teaching. And I always try to be like respectful and nice and not talk to them like they're idiots. Like with the shoes, I was like, well, maybe if you had shoes on, you know, maybe it would change. And I just try to be fun because you are in their house, and that is a big part of home health. Come correct, because you will get kicked out. You will get kicked out. And I've seen it happen. And I've only been with this company for 8 weeks. And it's just real fun to see them in their environment, like their own environment. Because you got to think, I always said I hated geriatrics. Hated it. Would never work in geriatrics. I've never worked in a nursing home, any of that. But I honestly realized that I love geriatric patients. It's just different with home health. Like, imagine, whenever you work in a nursing home, most of those people don't want to be there. They are not there because they decided it would be a nice place to stay. Most of them were put there, and they don't want to be there. So they're not the happiest. They're kind of grumpy. They're miserable. They're mad. They're angry. They're feeling all the feels. So they're not going to always treat you the best. Some of them will treat you like gold. Some of them will. But I noticed that nursing home is just not for me. But geriatrics and home health, I adore them. They are the sweetest people because they are so appreciative. They're so kind. Like they come up to you, or you come up to them, and they are grateful that you're there, and they let you know how grateful they are. It's just the sweetest. Like, I've had so many people try to give me gifts for Kian, and I'm like, no, it's fine. And then they're like, you're gonna take this. So like, Kian is always getting all kinds of snacks and stuff from people. But yeah, I'm on my way home because I have an hour break. I could sit at like Panera or something, but I don't really want to. And it's tricky because if you go home, your mileage, like it counts it as a commute. So I might go to like Panera or something and sit, but I honestly forgot my one charger and I need it. So I'm probably gonna run home. And yeah, my next patient has diabetes as well. A lot of diabetic wounds that I see. And a lot of people with diabetes, a lot of people with COPD, heart failure, all the things, which I'm still brushing up on, because you got to think, I was doing peds for so long. I did pediatric nursing for so long. You didn't really see a lot of diabetic foot ulcers and PICC lines and wound vacs and all that. So I'm still brushing up on everything. I have a bunch of textbooks that I read daily from when I was in nursing school. And, you know, nursing is all about continuing your education and learning as much as you can. So that's what I'm going to do later, because I do have like an hour in between patients, and then I'm just going to chart the rest of the day, which I have like maybe an hour of charting to do. Not bad, because I didn't have a start of care today. I'm pretty chill on the charting. But anyways, I'm blabbering on. I will see you guys soon. It is only 10:57 and I've seen 3 people. And I only have 1 visit left to do, plus a nursing consideration note. So that's just charting. So I'll see you guys soon. Okay, so I'm back. I went home because there's a lot of phone calls I had to make. And I don't really like making my phone calls in public places, especially because I have to say the patient's name and date of birth and stuff. So, and it's super hot to sit in my car running gas and doing things. So I went home, did a little bit of charting, and I called a couple doctors. So there's one patient. Being a case manager, you have to decide whether the frequency that you're seeing the patient is good for them, good for you. I had one patient, he has a PICC line, a PEG tube, and a hip wound, but we've been able to scrunch everything into one day. So I didn't really see a purpose to see him twice a week, because the second visit, we're kind of just sitting there staring at each other, getting his vitals, listening to his lungs and stuff. So I called the doctor, recommended that we switch him to once a week for the remainder of his time, and then recertify him at the end. And the doctor was okay with it, so I wrote the order, had him sign it, and then I had a daughter call me, and she reported that her mother fell last night. So I'm gonna do a pop-up visit on her. I'm on my way to her house now. And there's a bunch of stuff you have to do when patients fall, just like in a hospital or facility. It's no different. So I have to do like an incident report and all that. And I'm going to collect a urine sample because her family feels she has a UTI again. So I'm gonna do that. I have to cath her for that, because every time we do a clean catch for her, it comes back contaminated. So I'll show you guys my trunk, maybe. It looks a mess right now. But I keep catheters in my trunk for situations like this, where I have to do a straight cath to get a urinalysis sample. So I'm doing that. And then my day is complete visit-wise. I still have to do a good bit of charting, but that's no biggie. I didn't do a start of care today. Like I said, the person's not discharged from the hospital yet, or they're getting discharged today and they kind of just want to be left alone for a day, which I get. So I'll probably see her Monday. I'm still in orientation, like I said, but they have me at full productivity right now, and I am feeling it. It's like having to see so many people in one day, it's still just wild to me. But yeah, it's going well. It's like imposter syndrome a little bit. Like, I'm like, who am I to be a case manager, seeing all of these people, deciding whether they get recertified or discharged, all of those feelings. But I know it'll pass. And last week I had a moment with my supervisor, my supervisor's supervisor, and I was like, I can't do this. It's not meant for me. I'm not good enough for this job. And she kind of talked me off the cliff and talked me off the ledge, and I feel better now. So if you guys have any questions, leave them down below. I'm still pretty new, but I feel like I'm getting the hang of it slowly. I have like 8 minutes until I get to this patient's house, and then I'll check back in with you guys when I get home or whenever I leave the patient's house. But I will have to run to the lab to drop off the urine sample, which I'll probably just go to the hospital because the other labs around here always close so freaking early. So if I would have known that I needed a urinalysis from her, I would have gone and seen her earlier so that I could go to the regular lab instead of the hospital. The hospital is always so busy, but it is what it is. And the hospital is kind of out of the way, but they do pay you for lab visits. Whenever you go and drop stuff off at the lab, you just put in an extra note and they pay you for it. I think it's like $10 or something like that. But yeah, just a couple questions that somebody asked me. I work for an agency where you are paid per visit, which I have mixed feelings about because like today, my highest paying visit, I'm not able to see. So where the money is in home health is doing start of cares, admissions. That's where you're paid the most. And my admission got canceled for today. So today's kind of a low day, but with my company, I'm stipend a certain amount while in orientation. So it's a little different for me because I get that stipend. So I'm still going to get paid. I'm just not going to get paid more than what I could have gotten. You know what I mean? So yeah, I'm coming up on their house. So I will see you guys in a little bit. Okay, it is now 1:58. And yeah, today has been a day, but we're getting through it. Sorry for the crooked camera. It is what it is. This is the best I can do. I literally stopped at Target and picked up a tripod because I didn't have one in my car other than like my pop socket one. So I bought one that goes on the dashboard. Anyways, so I just finished straight capping that client or that patient. I have the urinalysis sample. Going to the lab. The lab that was close to her house closed at 2, and there was no way I was going to make it, so I just started heading out to the one that's further away. But it's by my house, and she was my last patient that I have to visit today, so it's fine. I'm on the highway, and our highway that goes through my town is like a death trap, so I drive very carefully on here. There's like at least 7 accidents a day. Like, it's always shut down. But anyways, so remember I told you that patient had fallen yesterday, and her daughter told me that she called the urologist, and the urologist wanted to get a urine sample, yada yada yada. Well, I still have to call the doctor to report that she fell. So I have to do that when I get home. I have to call my LPNs and see if I should reinsert these 2 people. And even though you're in home health and you're alone, you always have a team behind you, especially where I work. There is always somebody I can call if I have a question or anything. And I'm going to call both of my LPNs to see if they can give me more information. Just because I'm new with these 2 patients, I feel it's unfair to just go off of my judgment whether to recertify them or not when the LPNs see them way more than I do. So with my company, and I'm pretty sure it's probably just a Medicare thing, LPNs can do most visits except for like PIC lines and things like that. But a RN has to go out every 4 weeks to do a supervisory visit. So I've only seen those patients for the supervisory visits. I haven't seen them routinely like the LPNs do. So I'm going to email them, probably email just so I don't call them when they're probably in a visit. I'm going to email them, ask them if we can do like a case conference thing, and they can give me a little bit more information on them. So I always want to say, don't feel like you're alone in home health. If that's one of the things that's holding you back, there's always people you can call. There's always people you can email. You're not alone. You're alone, but you're not alone at the same time. Like, yes, it's you in the house by yourself, but the moment you leave, or if you need to call, so I've called somebody in the middle of a visit. If I feel like I'm noticing something, but I don't know if it's a change in their condition or not, and they're not able to tell me, I'm going to call somebody. So don't feel like you are just out by yourself, just sink or swim. It's not like that at all. There's always somebody that can help you. So I'm just going to go to the lab, and then I'm going to go home maybe I'll show you guys my trunk more, but I do need to order supplies, so my trunk looks a little bare right now. Like, it looks cluttered because I don't have like an organization system yet, but I will. I'm gonna order like bins and stuff, probably from Amazon or something, and organize my trunk a little bit better. But I need to order catheters, because I realized when I was straight cathing her, I used my last 14 French, and the rest of the ones I have are like 18, 22, 24, and you don't want to use that on some little old lady, have her ripping and screaming. No. So I need to order supplies, but it's Friday, so I might wait till Monday, because they're not going to get here for like forever, because my company, you have to order your supplies by Tuesday, and it's now Friday, so we'll see if I do that. But yeah, I'm coming up on my exit, and I'll see you guys in a little bit. Okay, so after a long wait at the lab, that is done. So I'm on my way home now. It's been a day. And sometimes I forget, like, all women are not built the same. And every time I do a female cath, I feel like it's my first cath that I've ever done, because lady bits don't look the same for everybody. And this lady, her bladder was showing through her vagina, so I'm like, okay, I see a hole here, but that doesn't look urethral like. Not going for that one, let's go for this one. And I made it on the first try, but I don't know how, because yeah. So it's been a good day. It's just been wild and been very active today, which is cool, like, because my last job, your girl was sedentary. Like, I did nothing. I didn't do a darn thing. So yeah, it's been a good day, and I'm trying to make the best of every situation I get. And yeah, that's how the day goes. So now I'm probably not gonna, my house is a mess. I haven't been able to clean nothing, so I'm probably not gonna like show you the rest of my charting, plus HIPAA and things. So I'm just going to go home, finish charting, emails, lots of emails, so many emails. I'm finding it really hard to like multitask during the day. Like, whenever I'm with a patient, I want it to be just about that patient. I don't like, if my phone rings, I don't answer it. It's my patient's time. My patient only gets me pretty much one day a week or once every other week. So I want my time that they do get to be just about them. So I try not to like worry about emails and things like that. Like, that can wait. So now it's time to handle the emails that I've been pushing off. Not pushing off, but just hadn't had the time to get to today. So I'm going to do that. Email some LPNs about some patients, and yeah, that's about it. So my day is pretty much over, and it's 2:32. So most of the time my day is over by like noon, except for charting. Like, seeing patients, I can usually fit them all in by noon, but this patient I had to squeeze in because of the possible UTI in the fall and stuff. So yeah, typically my day is quick, and you can set the pace of your day when you assign your visits. Like, I had one guy, I told him, hey, can I be there by 9? He was like, no. I said, can I be there by 11? And he said, can you be here by like 8? I like my visits early. Bet. It's a plan. I'll be there. So I got started at 8. So I had an 8, 9, 10, and a 1. So, you know, not bad. So you can set the pace of your day when you assign your visits. So what I do is I call my patients the day before to set up the visit, and I'll give them, I usually will plot, like, write everybody's address down and their name and their phone number, and I'll use MapQuest and plot out where everybody lives, who's the closest, who's the furthest. And I try to make my furthest visit the last one, because, or in the middle, it doesn't really matter, or in the middle, because my company, and I think most home health companies do this, when they do reimburse you mileage, they don't pay you for your the trip to your first visit and the trip from your last, because they consider that commute time, which I actually find fair, which it screws me sometimes because sometimes I go to my furthest visit first and then I don't get paid for that mileage. So it's up to you to just plan how you want your day to go. But yeah, I love the job so far. Like, I love everybody. The company I work for is really great, and they're only in select states, but if you're interested, if they're in your state, just message me on Instagram and I'll let you know. But yeah, today was a good day. I am hoping to do this again on Monday. I really liked filling you guys in on the day, and I still will do budgeting content. It's just I want to take you guys along the journey of my new job and just the changes that I'm going through. Plus, I see so many nurses that are getting discouraged with working in facilities and hospitals and nursing homes that I want people to know that there's other options out there. Like, home health can be for you, but you have to want it and you have to have the passion for it, because these little old people are firecrackers, baby. They will kick you out of their house, and the company is not going to like that, and you're not going to last. So you also have to be very knowledgeable and have people skills and all the things. But it's a great option if you're burnt out of working in the hospital. I've never worked in the hospital because I just always knew it wasn't for me. Constantly having supervisors and stuff down your throat, wondering if you're going to be charge nurse or not. I like knowing what I'm getting into. And even though home health can be, like today, I had that pop-up visit with the urinalysis and the fall and all that. So yeah, surprises can happen, but not as much as in a hospital. Like, I could never do ER, ever, never. Like, no, that's just not for me. But I always knew home health was for me, just the comfortability of it and just the closeness. Like, you get to see the same patient over and over again, so you get to build relationships with their family. The families are always super nice. So yeah, but anyways, I'm rambling again, which is what I tend to do whenever I film in the car. But I will see you guys in the next one. I hope you guys enjoyed this video. If you want more of these, just let me know and I will keep them coming. There's a lot of quiet time in the car, so I'm able to film these whenever, as long as I'm not on the phone or doing something like that. But I will see you guys in the next one. Bye.